Does the thought of being in a crowd or a social event make your heart race? Do you feel an overwhelming anxiety when you're given the chance to speak in front of people? Are you afraid of being judged by others? Or do you find it difficult to make friends or establish social connections? If yes, then you're in the right place. Today's topic is social anxiety disorder, or the condition of social nervousness. It's an issue that troubles many people. Let's understand it in depth. Let's take a look at its main points. First, we will see what it is, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, how can it be treated, and finally, its conclusion. First, let's understand what social anxiety disorder is. Social anxiety disorder, or the condition of social nervousness, is a condition in which a person feels nervousness or anxiety in social situations or among people. Imagine feeling like everyone is looking at you or laughing at you, but in reality, nothing like that is happening. This anxiety is so severe that it makes daily activities difficult. I hope now you have a bit of an idea about social anxiety disorder. Now, let's move on to the next point where we will learn about its types. There are no types of social anxiety disorder because it itself is a specific type of anxiety disorders. However, the severity or intensity can vary among different people. Some people might only have problems in specific situations, like speaking in a crowd or meeting new people, while some might feel it in most situations. So, friends, we understood here that there are no types of social anxiety disorder because it itself is a specific type of anxiety disorder. Now, let's move on to the next point, where we will learn about its symptoms. Some common symptoms of social anxiety disorder include, let's see from the first point, feeling extreme nervousness or anxiety when speaking in front of people or in social situations. Next, having trouble sleeping or feeling troubled by continuous thoughts. Next, finding it difficult to meet or talk to others. Next, feeling unnecessary fatigue or tension in the body. Next, getting upset quickly or overthinking. So, friends, these were some common symptoms of social anxiety disorder. If you or someone you know experiences these symptoms, it might be an indication of social anxiety disorder. Now let's move to the next point. There can be many reasons for it. Just as there are many symptoms, there are also many causes. But we have covered some common causes in this video. Let's start. If someone in your family has had issues with anxiety, you might have it too. Next, your surrounding environment, such as stress from school or work. Next, a chemical imbalance could also be a reason, like the brain's chemicals not functioning properly. These were some common causes. Now, let's move on to the next point, where we will see what can be done to prevent it. Let's start. There are some steps to prevent it, such as start doing regular exercise or yoga. It helps to keep the mind calm. Next, eat healthy, stay away from unhealthy food. Next, get good sleep, avoid phone or TV before going to bed. Next, to reduce stress, do meditation or deep breathing exercises. Now, let's move to the next point, where we will learn how its diagnosis, or testing, is done. Let's see how it is diagnosed. For its diagnosis, a doctor will ask you some questions and listen to your story. Sometimes, they might also conduct a blood test or other tests to ensure there isn't another illness causing these symptoms. These are some steps through which the diagnosis is made. Now let's move to an important point, where we will learn how it can be treated. Treatment for social anxiety disorder is possible. There are some specific remedies. Getting psychological help, such as a lot of benefits, can be gained from CBT. Next, based on the doctor's advice, you can also take some medications. Next, make changes to your daily routine, like doing regular exercise, eating healthy. So friends, this was today's discussion on social anxiety disorder. If you feel there is something missing in any point, please let us know in the comment box and share your strategies. Now, let's look at its conclusion. So friends, that was our discussion today on social anxiety disorder, or the condition of social nervousness. If you or someone you know or a family member shows such symptoms, please seek help. Remember, seeking help is not a weakness, but a step of courage. We all need help at some time, and in the case of mental health, it becomes even more important. Friends, I hope you liked our video today, and that it has taught you something new and important. If so, please like, share this video, and if you haven't subscribed to our channel yet, do it now, so you don't miss out on upcoming videos on such important topics. Take care of yourself, and stay happy. Thank you.